Hi, my name is Katie Swanson. I'm the Health and Nursing Care Administrator at SCARC. This is an additional training as opposed to the one on the March 13th because a lot has changed over the last week, right? There's more cases in the United States, there's more cases in New Jersey, and now there's cases in Sussex County. Governor Murphy is releasing YouTube videos daily on alerts on how to handle COVID and what the plan of actions are. So they're really informative if you wanted to check them out. So we are still focusing on prevention and preparedness. So we're focusing on several things. First being hand hygiene for all staff and individuals, washing frequently and often, such as after you wake up, after using the restroom, before preparing food, and after touching frequently touched objects. Secondly, overall hygiene. This is just for me, this isn't from the CDC. I believe in cold and flu season, we should really wash up and clean clothes before work and upon returning home. We don't want to bring anything into work and we don't want to bring anything home with us. Also respiratory hygiene, covering our cough, our sneezes with our elbow or tissue, then washing our hands. Avoid touching your face. Social distancing, not giving the virus anywhere to go. Right now we're sheltering in place in our programs, and I encourage our employees to do the same when not working. Keep 3 to 6 feet distance from others when possible. As far as medical appointments go, really all of our medical appointments should be canceled except for those that are really critical. And please, if there is a critical appointment that's scheduled or is being kept, talk to the director or myself to decide if it's really pertinent or not. We're still cleaning and disinfecting frequently, focusing on the objects most commonly touched, such as tabletops, doorknobs, writing utensils, cell phones, keyboards, remotes, light switches, adaptive equipment, etc. Those programs that have PPE kits, please don't use them. We will let you know if we're using PPE equipment. We don't want to waste our resources if they aren't necessary. Plus, it's important that everyone's trained how to put them on and off so we don't spread infection. We don't want to make anything worse. Please make sure you have working thermometers and probe covers. And illness. So treatment is basically the same, whether positive or not confirmed. We're treating it symptomatically. And we're also preventing those in close contact. So stay home if sick and call the doctor and alert him or her of the symptoms for guidance. Mary Jo, Janice, and the directors and I are in constant contact regarding illness. If an employee is sick, fever, cough, sore throat, shortness of breath, difficulty breathing, etc., obviously call 911 if it's a life emergency. Call your doctor for advice and guidance. And when you speak to the doctor, ask for a probable diagnosis, recommended treatment, and when to return to work. Also, I would like to speak with the staff personally to screen them, get to know what's going on, so we could best handle the situation. We don't want you to come in sick. And we want to make sure all employees are cleared before they return to work. Okay, so prevention and preparedness aside, I wanted to take a moment to really focus on our own well-being as employees of SCARC. It's a difficult time right now. It can be really anxious and stressful. Being direct caregivers and essential staff is really important for those that we serve. I like to give the example of being in a plane. When we have our oxygen masks, they always say put on your own oxygen mask first. And then help people to the sides of you because you're useless if you don't. That's how I feel being a caregiver is. We really need to take care of ourselves so that we could best help those we care for. So how our minds and bodies are reacting to the stress, medication, cleansing breaths, grounding techniques, taking breaks, taking time for yourself to check in with yourself, make sure that you're okay. I'll be sending out links to reduce stress and anxiety when in crisis, as well as helplines. There's free counselors available to talk and text with. I did try this out. You could text 66746 and text back and forth with a counselor, or you could call 1-800-985-5990, but we'll send out all the links that'll be posted on our website. And I just wanted to say thank you for being respectful and responsible in keeping yourself, the individuals we serve, and our community safe and illness-free.